Hello lovely viewers, welcome back again to my channel. This is your midwife Bella. If you are new here, kindly like, share and subscribe. Many pregnant moms or women have wondered how labor feels like, how long it will take, and how to know whether it's a real deal or just a false alarm. It's hard to predict the answers to all those questions since every birth is different. But knowing what labor is and what signs to look out for will help provide clues that it's almost time to meet your baby. Here are 10 signs of true labor. Don't go anywhere. Keep watching. Hello guys, welcome back. We are still on the topic 10 signs of labor. Now, 10 signs that labor is near and your baby's birthday is almost here. Now, what is labor? Labor is the process of childbirth, starting with contractions of the uterus and ending with the delivery of the baby. Now, let's come to the 10 signs of labor that tells you that baby is on its way. First one, we say baby drops. Second, cervix dilates. 3, cramps and increased back pain. 4, loose feeling joint. 5, diarrhea. 6, weight gain stops. 7, fatigue and nesting instincts. 6, vaginal discharge changes color and consistency. 7, stronger, more frequent contractions. And 8, water breaks. Now, how to tell if you are in labor? The first point, which was your baby drops. Now, if you are a first-time mom, your baby will typically start to drop or descend into your pelvis a few weeks before labor begins. Usually around 2 to 4 weeks before, but it can vary. Now we move to 2, your cervix dilates. Your cervix too is starting to prepare for birth. It starts to dilate, that's open, and efface, that means thinning out, in the days or weeks before your delivery. At your weekly checkups in the home stretch of your pregnancy, your provider may measure and track dilatation and effacement via an internal exams. But everyone progresses differently, so don't be discouraged if you are dilating slowly or not at all yet. Now 3, you feel more cramps and increased back pain. Now, especially if this is not your first pregnancy, you may feel some crampiness and pain in your lower back and groin as labor nears. Your muscles and joints are stretching and stiffen in preparation of your birth. Now 4, your joints feel looser. Throughout your pregnancy, the hormone relaxin has made your ligament loosen up a little. It's also responsible for your potential bout of clumsiness this past trimester. Before you go into labor, you may notice that the joints all over your body feel a bit less tight and more relaxed. It's just nature's way of opening your cervix, your pelvis, for your little passenger to make his way into the world. Wow. Now let's move to 5. You have diarrhea. Now, just as the muscles in your uterus are relaxing in preparation for birth, so too are other muscles in your body, including those in the rectum, and then can lead to diarrhea, that pesky labor symptom you may well have experienced at other times during pregnancy. Though annoying, it's completely normal. Just be sure to stay hydrated and remember it's a good sign. Now 6, you stop gaining weight or you lose some pounds. Weight gain often levels off at the very end of pregnancy. Some moms to be even lose a couple of pounds. This is normal and won't affect your baby's weight. He's still gaining, but you are dropping due to lower levels of amniotic fluid, more bathroom breaks, and maybe even increased activity. Now we move to 7. You feel extra tired or you have an urge to nest. Wait a minute. Is this the third trimester or the first? Between the active bladder and the exhaustion, sometimes you can feel like you have traveled backwards in time. That supersized belly, along with your compressed bladder and other organs, can make it tricky to get a good night's sleep during the last days and weeks of pregnancy. So pile up those pillows and take naps when you can, if at all possible. That is, unless you are feeling the opposite of super sleepy. Some moms get a burst of energy, also known as the nesting instinct, as their body's birthday nears and can't resist the compelling urge to clean and organize everything in sight. That's okay too, as long as you don't overdo it. Now, the early labor, the days and hours before labor starts. Now, you lose your mucus plug and your vaginal discharge changes color and consistency. You may also notice the loss of your mucus plug, the cork sealing of your uterus from the outside world. It can come out in one large piece. It looks similar to the mucus in your nose, or lots of little ones. Though you may not get a glimpse of it at all, and some women don't lose it before delivery. In the last days before labor, you will likely see increased or thickened vaginal discharge. This thickened pinkish discharge is called bloody show, and it is a good indication that labor is imminent. But without contractions or dilatation of 3 to 4 centimeters, labor could still be a few days away. Now, you feel stronger, more frequent contractions. Contractions are an early sign of active labor, except when they aren't. You can experience Braxton Hicks contractions or practice contractions for weeks and even months before delivery. You will feel their pinch as the muscles in your uterus tighten in preparation for their big moment, pushing that baby out. How can you tell the difference between real and false labor contractions? Look at these signs of real labor. If you are active, real contractions get stronger instead of easing up the way Braxton Hicks contractions do. If you change positions, labor contractions don't go away, but Braxton Hicks often do. Real contractions progress, becoming more frequent and more painful as time goes on, often falling into a regular pattern. Each one won't necessarily be more painful or longer than the other before it, but the intensity tends to build over time as labor progresses. Frequency doesn't always increase in the regular pattern either, but it does gradually increase. Braxton Hicks contractions come and go without getting more intense over time. Early real labor contractions could feel like strong menstrual cramps, stomach upset, or lower abdominal pressure. Pain could be in the lower abdomen or both there and the lower back, and it could radiate down into the legs. The location of the pain isn't as reliable as an indicator of true versus practice contractions, though, because Braxton Hicks contractions can also be felt in all those places. Now, next is your water breaks. While movies would have you think you will learn you are in labor only when your water breaks in the middle of a romantic dinner date at a busy restaurant, of course, that's a very unlikely scenario. Your water breaking is actually one of the final signs of labor most women experience, and it happens in only around 15% of births or fewer. So don't count on it as a telltale, surefire signs of labor. Still feel like you won't know when to announce its time and get ready to meet your baby. Try not to stress about it. You will be seeing your doctor or midwife frequently now, and he or she will help you spot all the important clues. Now, you should always call your doctor or midwife if you experience any bleeding or bright red discharge, not brown or pinkish, 2, your water breaks, especially if the fluid looks green or brown. This could be a sign that meconium or your baby's first stool is present, which can be dangerous if your baby ingests it during birth. 3, you experience blurred or double vision, a severe headache or sudden swelling. This can all be signs of preeclampsia, which is characterized by pregnancy-induced high blood pressure and requires medical attention. Thank you for staying tuned. See you in the next video.